Hi, my name is Courtney Harkins, and for my interview project, I have chosen to interview my mom, Vicki Harkins, who has been a nurse at the University of Iowa Hospital for more than 30 years. So, Vicki, can you tell me what led you on this career path to become a nurse?
Well, Courtney, I've always enjoyed helping other people, and my sister got very critically ill and died my senior year in high school, and after spending a lot of time in the hospital with her, I knew that nursing was something that I wanted to pursue.
I see. And what type of schooling do you need in order to work towards this career?
Well, at the time I made my decision late, but I did take extra chemistry, biology in high school, and I did research the different schools of nursing at the time, and I chose the Allen Memorial School of Nursing in Waterloo for my education, and one of the reasons I chose that school was because I saw that their graduates had the highest degree percentage of people passing their boards.
I see. And you've told us that you've been working at the University of Iowa Hospital for more than 30 years. What led you to come across the University of Iowa Hospital as your choice of employment?
Well, to put myself through school, I worked as a nursing assistant in the emergency room at Allen Hospital, and I fell in love with emergency room nursing. And I met a couple flight nurses, and my dream was to become a flight nurse. And the only flight nurse program in Iowa at the time was at the University of Iowa.
Wow. Are there any certain requirements needed to become a flight nurse?
Well, at the time they did require that you had at least a year or two of emergency room nursing, and that you also had a year of intensive care nursing. I chose to go a year in the medical intensive care unit, and then I worked about 6 years in the emergency room before I got a position as a flight nurse. Then once you are chosen to be a flight nurse, then you have extra training in the trauma nursing area, intubation, and chest tube placements.
I see. So what is your current career as of today?
Today I am in a less dramatic field. I work in the ambulatory surgery center, and one of the reasons I did this, it's a little more family friendly, and at my age it also allows me that I have a straight day job. I no longer have to work weekends and holidays and nights.
That's always nice. So in this career then, what are your daily duties?
Well, as a post-op surgical nurse, in the pre-op part of it, we get all the patients ready, which means that we bring them in, draw labs, start IVs, make sure all the paperwork such as consents, history and physical, all their medications and everything are up to date, and that they haven't eaten, because you cannot eat before surgery or you will be canceled. Okay. And then also in the post-op area then, we are responsible for making sure their airways are maintained, that we control their pain and nausea. And a very large part of post-op nursing is post-op teaching to both the patient and the family. And this concerns taking care of their wounds that we have created, and also the anesthetic event, which can be quite taxing to several of our patients.
Wow, sounds like you can have quite an interesting day.
I love it.
What then do you find most rewarding about your job?
I love all the people that I meet and all their different psychosocial events, especially coming into a surgical procedure. Some of these are very minor, some of these are biopsies for cancer. It's a very large family and psychosocial event, and I truly enjoy the people.
I see. So if you had the same opportunity, would you choose this opportunity again to become a nurse?
Yes, I love nursing. I have never regretted choosing it, and I would definitely choose it again.
That's great. However, do you ever wish that you would have done anything different, such as schooling, to try to prepare yourself for your career as a nurse?
Like I said earlier, I think if I would have known I was going to choose the nursing career, or as advice to other people choosing a nursing career, that in high school or in your early college years, if you don't quite know what you want, center on chemistry, biology, and the health science issues. And then if you're in high school and you're a freshman or something like that, try to work a summer job in a hospital or some healthcare related field, so you get the feel of what nursing in the healthcare environment is like.
I see. And what do you think is the outlook for your career long term? In the next 10 years, do you think that nursing is still going to be quite popular?
Nursing is always going to be popular, and especially being it's branched out in so many different career opportunities. What I do see right now, though, is it's hard for nursing students to get in because we have a shortage of nursing instructors, which we need to maybe tell more nurses to become instructors. Also, that nurses are tending to branch off into the administrative roles or roles such as nurse practitioner or nurse anesthetist, which is kind of leaving the patient care area a little bit short on help, but it's always going to be a popular and decent paying job, and at this time in our economy, it's always a job that offers health care insurance and some stability.
That is always a great thing. So you would recommend this as a career to a young person in college or a person getting ready to graduate high school and start their career in college?
Yes, I would, if it's something they want to do. I think when you become a nurse or get into healthcare, you have to love people, you have to know you have to be patient, and that you put your patient first.
So is there any type of schooling advice you'd give to somebody who wants to become a nurse?
I think I stated that a little bit early, Courtney. Like I said, find out if you want to do that, get a summer job in the healthcare area, or find some place where you can be centered around healthcare professionals and make sure it is a field that you desire to obtain.
I see. Well, it sounds like you very much love your job, and I thank you for sharing your insights with us on your career as a nurse. And I hope after watching this video that many people out there may decide to choose nursing as their career in college.
And I do too.
Thank you.